Hey everyone, Dr. Phil here. So I said in class last night that I would do a video on the pelvis. So here's the model that I have here in my office. So on the left, get the male pelvis here. All right, and if you look, I go here to here, it is taller, inferior to superior than the female pelvis. Right? And if you look also, the male pelvis, the pelvic brim in here is narrow. The female pelvis, it's much, much wider. Okay, so female pelvis, it's going to be shorter, inferior to superior, and it's wider. And then males, it should be larger from inferior to superior and narrower medial lateral. So that's one distinguishing difference. So in the lab practical, they could ask you what might be some differences. So you want to look at the pelvic brim and the width, the height, and that should be relatively basic, just due to pelvic brim being wider for the fetus. And then we'll get into some of the distinguishing pubic tubercle, pubic symphysis. We'll get into some of the different parts of the bones and things they could be asking you on the practical. So I'm going to slide the iPad over and record this. Sorry, I'm in the microbiology room, so I don't know what's going to show up in the background. But I have a few things out here to take a look at, and I wanted to let's get this closer here, guys. Sorry. Pull up some of the bones here, and then we can take a look in your lab book. And what I've done is I've gone in your lab book and highlighted some things right out of your lab book, and I also took the required bone markings off of your sheet. All right, so I'm going to see if I can get this over here so I can get this a little better. So on the ilium here, it wants to go into the iliac crest. Your iliac crest, remember this is going to be anterior, posterior. Your iliac crest is going to be this area up in here, cresting, okay. The ASIS, anterior superior iliac crest, here's the crest. Anterior superior iliac crest, that should make sense because it's the crest, right? And then down here, if they tag this portion in here, sorry, this is going to be the anterior inferior iliac crest. So superior, inferior iliac crest. Here's your iliac fossa. Remember, fossa means, well, it can be, we had a discussion last night about the glenoid fossa or glenoid cavity. So a fossa is going to be usually an indentation for something. So in the human, it can be part of, so if we're looking at, this would be posterior, we're looking from right to left. All right, sigmoid cone would come down in through here also. Okay, the other couple things we have on here, we want to talk about the pubic tubercle. So it's right here. All right, there's your pubic symphysis. Here's your ischium. Right down here, because this is a part that you sit on. Talked about that in lab last night. And then once again, this is going to be your pelvic brim. If they mark that, you're going to just tell me that's the pelvic brim. Okay, we're looking at a full pelvis, so those are some of the things they could ask you. Once again, pubic symphysis, pubic tubercle, ischium. Here is your acetabulum, which I said means vinegar bowl. And they could ask you, what is this area? What is, what part of the bone is this? Right, and this is divided into 3 different parts, right? Because when you're a fetus, Right? It'll be separate, they'll fuse together, but they could ask you, what does that articulate with? And last time we went over that, remember that's going to be the head of the femur. All right, so I'm going to put this back here on the side. We'll take a look here again. Okay, so this I think should be lined up sort of with your picture in your lab book here. So once again, here's that iliac fossa here. Okay, and remember, this is going to be, you got to figure out, if we're looking at this, this is going to be the right, because there is your auricular surface for your sacrum. Right, and I actually was able to find a real sacrum. So look at the difference in the bone and texture, but there's your sacrum. There, this is the auricular surface. So I know this is the anterior, this is the posterior, because on the last practical we had the median crest. This is posterior. It's going to fit in through here like that. Or we want to see the whole thing put together. Auricular surface here with a contact. And once again, this is your SI joint, sacroiliac joint. All right, we'll get into the notches here in just a minute. So I don't know what order that we want to do this in, but this is going to be in this position. This would be the right. Okay, so here's your iliac fossa. You can think of smooth or something. The auricular surface for the sacrum. Right, it says in your lab book right here. And then right here is your greater sciatic notch. All right, so don't tell me it is a foramen, don't tell me it is a groove, whatever. That is a notch, very large notch. But I also highlighted on here, you're going to want to remember the acetabulum. So figure out what this is. This, again, this is inside, deep, superficial. That's your acetabulum for the head of the femur. And then if you look at your lab book, it'll show you over here, this is actually 3 different bones. So in your bone markings, it breaks it down. The coxal bones, and I said that I personally call them the os coccyx. And if you don't believe me, it's right up here in your lab book. It says coxal bone or the os coccyx. So I learned it technically as the os coccyx. You guys can, call it whatever you want, but just realize when you're looking at this, don't get confused. Realize it's going to be your acetabulum is out here, so it's going to be lateral. There's your pelvic bones in here. There's your pubic symphysis, pubic tubercle. Okay. And then this is going to be the ischium. Ischial tuberosity. Tuberosity means bump. There's your ischial tuberosity. So look for that greater notch. Back here, they could ask you that. They love to ask that question. Then you have a lesser iliac spine up in here. Okay. You have a lesser notch in here also. And then just realize, we go to the back. Okay. So this part of your lab book, there's your posterior. This is posterior, superior iliac spine, or we call it in chiropractic, we call it the PSIS. Right? And that's an adjusting point we have. And then right here would be the posterior inferior iliac spine. So PSIS, we call this the PIIS, just for short, posterior superior iliac spine, posterior inferior iliac spine. And then right in here, where there's going to be your greater notch if they ask you that. And we said in lab last night, that's for the sciatic nerve. And then you have this right here where my thumb is. That is the ischial spine. If you're not sure, it kind of looks like a spinous process from the vertebral bodies that we talked about before. And then your ischial tuberosity. So if they tag that, well, we just call it ish tube or ischial tuberosity in our field. And once again, if we go over here, this is the acetabulum for the head of the femur. And always remember, if they ask you, acetabulum is going to be out lateral. So this would be the posterior, the posterior surface. And I asked everyone last night, you know, what muscles are there? So your glutes. And then we have the head of the femur in here. And then we have that greater trochanter over in here. And I said, that's where all those muscles attach. So your patients will always point to their hip and tell you it's sore. That's the reason. So I think that's all that they're requiring you to do. All right, but in your lab book here, it says auricular surface. So what does it articulate with? Once again, remember, it's going to articulate right here with that sacrum. Be similar to this. That surface right here is your SI joint, sacral iliac joint. And that is definitely slightly flexible. So when you go to walk, this should pivot slightly. It should rock just a little bit. I think that's all on that. I just wanted to once again show you that. So when you go to open lab or whatever, you want to take a look at it. And once again, maybe I'll go on. Male, female. This is wider and shorter this way. This is going to be longer this way, narrower this way. Okay, and that, everyone, is an actual real sacrum. Right. If you look, or maybe if you zoom later, there is that trabecular bone. Right. If I can make that noise, you can hear that. But that is rough, and you can see that trabecular, how's that spongy bone? It's there. And this is super light, as opposed to the plastic model. All right, I'm going to end that here, and I'm going to do another video. I'm going to just bring it over here, and I've got some stuff set up. I want to go over the hip joint real quick in my next video.